Here in Nashville, I had the opportunity to give a talk on fat grafting and fillers, and really it's not so much the technique, although that's part of it, it's really the concept and the design and the philosophy of making faces look beautiful. So my concept involves halos and shadows and shapes, because when we look at a face, instantaneously we know if that person looks beautiful, youthful, or artificial and fake. A large part of the problems have been central facial injections, lips and cheeks, which I shy away from. I think there's a dynamic problem particularly and a static issue. So what I'm doing now is really filling around the borders, making the shape of the face more oval, which is more attractive, and obviously designing it for a particular patient's physiognomy or facial shape. The other thing around the eyes, because when we connect with each other, we connect with the eyes. So when I work around the eyes, I've developed this asymmetric triangle idea, which is the idea that if the upper brow area in particular is problematic when it looks sagging, if we just fill a little bit in the inside, it creates this horizontalization of the art that makes it look so much more captivating. So we forgot about the inside brow. We know about the inner tear trough, which is important, but the outer part is just as important. So it's a circular frame. The final halo is around the mouth. So when you fill and frame that area, it looks beautiful. It's not just filling the fold. It's a reshaping of the face in a way that's very subtle and beautiful. And you can do that with both fat transfer and with fillers. These are just two methods, surgically and non-surgically, to achieve them. This video is too short to really go through the differences and how I approach it. That's what my lecture was all about. But I hope that you start to understand beauty, and I challenge my surgical colleagues not just to be technicians, but to be true artists. What I wanted to do as program chair is make this program very different. What we've done in essence is cut down a lot of the non-educational content, which has been a major negative in the past. We have really streamlined and focused everything into topics into facial reconstruction, rhinoplasty, facial rejuvenation, and business development. And we've done that all through the 3 days, which is great. And we brought in new speakers. People have been tired of hearing the same speakers. So with all these new speakers, these new concepts and new ideas, I hope it paves the way for a new standard for the future of meetings.